Cool. So, what brought you in today to see the doctor?
Well, I was having some chest pain, and so I came into the ER and saw the doctor, and they were able to take care of me.
Okay. And I know we just wanted to review this. My name's Sarah, and I'm an RN, just going to go over some educational opportunities with what you've been diagnosed. So, stable angina. And what's your name and date of birth?
I'm Ruth, and my date of birth is 1/1/63.
Okay, thank you.
Mm-hmm.
So what do you know now about stable angina?
Well, I know the doctor came in and talked to me a little bit about it, but I don't really quite understand what angina, is that what you said?
So stable angina. Some people say angina, both are fine, both are correct. But this is just, who's with you today?
Hi, my name is Angelina. I'm your granddaughter.
Angelina, nice to meet you.
Yeah,
Sorry, let's do this again.
No problem.
Alright, so the stable angina, that's where your heart is not getting enough blood flow or oxygen to it. So you'll notice that chest pain. Do you have chest pain?
Yeah, I notice it more when I came into the hospital because I was doing my stepping up and down the stairs. Try to work out a little bit, and I just noticed that's when the chest pain started.
Okay. And does that pain go away when you stop exercising and you're resting?
Yeah, I did a little bit. Mm-hmm.
It does completely?
Yeah.
So that means they think that it's stable because the pain does go away when you're resting.
Okay.
Oh, that's good.
So that's good. Yeah, it's a good thing. And we actually encourage you to rest if you're having that kind of pain because
See, I told you, Grandma.
So resting is going to
Exactly.
make the pain go away.
yeah, resting should make the pain go away with the type of angina that you have, and they want you to do that. So your heart is telling you to rest if you're having that pain, okay? And another thing, did they talk about nitroglycerin to you?
Was that the medication that they were talking about?
Yeah, so it's in it's a little brown bottle that it comes in, and it's brown because it needs to be kept out of the light, okay? So the medication breaks down when it's placed in sunlight, so you want to keep it outside of light, keep it in that container, unless you need to use it, then you'll take it out. And did they tell you how to administer that medication?
Something about sub something, but I didn't understand what
Yeah.
that meant.
Yeah, so sublingual means that it's underneath the tongue. So you place it underneath the tongue, close your mouth, just let it dissolve, and then that medication will start to work. If you still have pain 5 minutes later, you can take another one, and then assess to see if there's pain 5 minutes after that. If there is still pain, she can have a third pill, okay? One pill each time. You're going to want to make sure you change positions slowly between each pill and afterwards, because each pill can last for an hour. So you want to make sure you change positions slowly, because this medication actually opens up your blood vessels, like your veins, so that more blood can flow through to your heart and hopefully prevent this pain and allow your heart to work more efficiently.
So she just keeps taking them forever until her pain, like a couple hours. She'll just take one every 5 minutes, and then, or does she stop after a certain amount? Or?
Great question. Yeah, so she can only take this pill 3 times.
3 times.
5 minutes apart each time.
Okay.
And after the 3rd time, if she's still having pain, you need to call 911, seek medical attention.
Very
quickly.
important.
So,
Okay.
yep, so very
Okay.
important. Only those 3. And also, we just want to make sure that when you're taking this medication, that you are checking your blood pressure between each doses, and just so you know, it can cause a headache because the blood's all rushing to your brain too. So you can just have a mild headache with that as well.
Okay. So it's not always me causing your headache.
No, it's not always her causing a headache. And also, I see that they ordered a stress test. What do you know about that?
She can't do a stress test. She can hardly walk.
Okay.
I mean, she does the stepper, but like really, we can't stress her.
Yeah.
I don't want her to get hurt or anything.
Yeah. So you know about a stress test that they usually put you through an exercise, your heart to exercise it, see how it's functioning under that type of stress. So yeah, if she can't do that, that's fine, because they actually can do a chemical version of stress where it acts like exercise on your heart, or the chemical does, and then you aren't actually physically doing the treadmill or the
okay,
exercise that's
okay.
making your heart rate go up.
So I don't actually have to walk on the treadmill then.
You don't, right?
Good,
So and
okay.
they'll monitor you the whole time. They'll make sure that it's safe and that the medication is doing what it's supposed to do, so they can see the imaging of the tracing of your heart.
Okay.
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 Yeah. So what kinds of questions do you have?
Will she need like any lab work or anything? They haven't drawn any blood yet.
Okay.
You think?
So I'll give you a heads up, if you do need to go, if you do take your 3 nitro and the pain still hasn't gone away and you go to the ER, they might check like a troponin level,
Okay.
okay? And that's just to see if you are having a heart attack of any level of severity.
That would
And
show
then
it, okay.
That would
okay.
show, yeah, that would help to show them. And then also, in the meantime, I also see that your doctor has ordered a cholesterol panel. And are you familiar with what that is?
I think I get that drawn occasionally with my normal doctor.
With your normal doctor?
Yes.
Yeah. So cholesterol is helpful to determine if you have a lot of those healthy and unhealthy fats, the cholesterol in your blood that can build up on the lining of your blood vessels. And we just want to check to see if you have a high level of cholesterol in your blood, because if you do, that may mean that your blood vessels are collecting a plaque, which can limit the blood flow, which could be a reason that you have chest pain if the blood flow is limited from that plaque.
So that's what
Okay.
caused my angina then?
So that could be a cause of your angina, so that's likely why they're wanting to order these labs for you.
Okay.
So you'll want to get that done. It is a fasting lab, so you want to make sure that you fast about 10 hours prior to going to the lab. You can drink water and take your medications,
Okay.
but you just want to make sure you get that done soon so they know what your levels are, okay?
Okay.
So, all right. Well, that's good. Do you have any
Yeah.
other questions?
No, I think you
so, yeah.
answered all of them.
Thank you so
Okay.
much.
You're welcome.
All
Have a
right.
good day.
Yeah, you too.
Thank you.
All right. So we'll just do that basically.